Because the newborn screening system in the United States effectively screens over 99% of newborns, it has the potential to provide a unique platform for understanding rare disease and lifelong outcomes. In fact, the process of neonatal screening, followed by coordinated transition to clinical care, helps to facilitate the collection of health information beginning just hours after birth. And because the majority of newborn screening conditions require lifelong care and management, we now have the opportunity to conduct prospective, longitudinal natural history studies on a population basis with unbiased ascertainment. Next slide. Because expansion of screening panels usually begins with a recommendation to screen based on the recommended uniform panel nomination, the steps involved in a RUSP nomination and the evidence review helps inform our efforts in data collection and newborn screening expansion. Key to these are considering the net benefit, feasibility, and readiness to all of these efforts. Next slide. A review of the developments over the last 60 years helps us all to quantify the increase in the number and diversity of conditions, interventions, screening technologies, and the clinical care teams and specialists that are involved in caring for these newborns. We can look at each of these areas to identify and assess potential sources of data that will help inform our efforts. Next slide. In addition to these advances and changes to newborn screening over the last 6 decades, reviewing the key components of newborn screening helps to identify stakeholders and points of communication and data collection that could be helpful to learn more about the policies and practices of newborn screening, as well as a location of data points to help inform surveillance and outcome measurements. Next slide. This graphic summarizes the key components of newborn screening and newborn screening expansion. And this image lists some of the characteristics of each component of newborn screening and helps us as we think about the potential to identify and use the data that's collected as part of screening, diagnosis, care, and management. Next slide. 35 core conditions are included in the recommended uniform panel.